Number 2. A pathologist is sent a poorly labeled fluid sample for gram staining. The test reveals a gram-positive rod that forms long, branching filaments that resemble fungi. What are the possible bacterial microorganisms found in this sample? Actinomyces and Nocardia both fit this description. However, although they resemble fungi on a gram stain, they are both bacteria, not fungi. They appear as characteristic gram-positive rods with long branching filaments. How are these two microorganisms differentiated? Actinomyces israeli is a non-acid-fast, filamentous, anaerobic organism and has characteristic sulfur granules. Nocardia, on the other hand, is weakly acid-fast and an aerobic organism. What are the other obligate aerobic and anaerobic organisms? The aerobic organisms are Nocardia, Pseudomonas, Mycobacteria, and Bacillus species. And the mnemonic is nagging pests must breathe. So that's Nocardia, Pseudomonas, Mycobacteria, and Bacillus species. Nagging pests must breathe. Next, the anaerobic organisms are Clostridium, Bacteroides, and Actinomyces species. And the mnemonic is can't breathe air. Clostridium, Bacteroides, and Actinomyces. After paging the intern, the pathologist learns the sample was drained from an oral abscess. Now, which of these two microorganisms is most likely? Actinomyces is more likely because it is part of the normal oral flora and can cause abscesses in the mouth or gastrointestinal tract after trauma. Nocardia is an opportunistic infection and most often results in pulmonary symptoms due to lung abscesses, or rarely central nervous system symptoms due to brain abscesses. If this microorganism were found in a sputum sample that stained weakly acid-fast, what could be inferred about the patient's immune status? Nocardia is most often found in immunocompromised patients. The clinical presentation and acid-fast sputum sample resembles that of tuberculosis in this high-risk group and is commonly misdiagnosed as such in immunocompromised patients. What is the appropriate treatment for each of these microorganisms? Nocardia is treated with trimethoprim sulfamethoxazole, and actinomyces is treated with penicillin G.